Hi, hello everybody. Come in, sit with me, chat with me while the kids play. Today we are talking about ARFID. ARFID is an eating disorder that stands for Avoidant Restrictive Food Intake Disorder. You might have heard ARFID referred to as extreme picky eating, but that's oversimplified. I'm Dr. Taylor and I talk all about healthy relationships with food for kids and the science of feeding kids. So ARFID, it sometimes accompanies neurodivergence like autism or ADHD, but not always. So I'm gonna go through six really common questions about ARFID. I posted about ARFID on my Instagram page. I actually posted a couple times recently, and these are the most asked things. So I wanted to address it all in one quick video and easy resource. So how is ARFID different from picky eating? So ARFID has a clinical diagnosis, like it is defined. The diagnosis is in the DSM-5, which is a handbook for mental health practitioners like psychologists to diagnose mental health conditions and neurodivergence. But there is no set definition for picky eating. When you look at different articles in the literature, they all kind of define it just a little bit differently. So while I'm going to define and differentiate these two for you here, you might find that there's like a little bit of gray area. What some people consider picky eating actually will fall into the ARFID bucket. Really quick, I also want to differentiate ARFID from other eating disorders. So in ARFID, there's no body image component. So like you won't see someone wanting to pursue weight loss or gain muscle mass, for example. All the issues with food within ARFID are completely independent of body image. So what's the difference between ARFID and picky eating? First of all, ARFID will continue past the typical toddler picky eating neophobia phase. Most picky eaters who become picky in toddlerhood will move through that phase without professional support. Not all, but most. For a child with ARFID, they won't. They need professional support to expand their diet or address any underlying issues. ARFID also has much more severe consequences than picky eating or even problem feeding. Picky eaters are usually still able to maintain like the overall intake that they need to grow. Even though their diet might be more limited than their peers, they still get enough of what they need. And picky eaters usually don't have significant nutrient deficiencies, growth limitations, or even weight loss. But kids with ARFID do have those things, and they may even need to rely on supplemental nutrition like tube feeding or shakes like Pediasure or Cake Farms or Else Shakes. Or they might need vitamin supplementation to meet the minimum requirements for what their body needs and what they need to grow. In addition, kids with ARFID also may have severe psychosocial consequences from their eating struggles. Like they might not be able to eat out at a restaurant or eat at a friend's house, or eating at a birthday party can cause intense amounts of anxiety. Maybe they can't even eat in the cafeteria at school. Now, if your child has a nutrient deficiency, like iron deficiency, for example, does that mean that they have ARFID? No, it doesn't. But nutrient deficiencies are more common in kids with ARFID than they are in like the general population or even picky eaters. ARFID is also not diagnosed when the lack of eating is due to the lack of food availability or cultural fasting practices. So why do kids have ARFID? Well, it's thought that there's three different subtypes of ARFID. The first is trauma-related or fear of aversive consequences. This can be due to like a choking incident or vomiting if the child has emetophobia, or reflux and like intense pain with eating, or related to abuse like using food as a punishment. So technically, in order to be diagnosed with ARFID, when the food issues are related to another medical condition like eosinophilic esophagitis, for example, the eating struggles have to be considered more intense or just greater in magnitude than what's typically considered as normal for that medical condition. I'm going to talk about why this is problematic at the end of the video and talk about why we may have a better label for these feeding struggles than ARFID at the end. The second subtype of ARFID is related to sensory sensitivities. So like a significant oral aversion or just aversion to the food because of the sensory qualities of the food. Whole food groups are eliminated. Less than 2 foods are accepted per type, rejecting all foods of a certain sensory characteristic like certain texture. And these sensory qualities can be related to like taste, smell, appearance, texture, obviously, temperature, the messiness. Now, texture aversions and struggles with food textures are common, but with ARFID, it's all about the magnitude. So how is this impacting the child's ability to have diet variety, to like have a good quality of life? How is it affecting their life outside of eating? How is it affecting their health, nutrition? That's where we differentiate between just like texture aversions, which are very common, especially with neurodivergent children, and ARFID. And the third subtype of ARFID is just like a disinterest in food or apparent lack of interest in food. For example, eating is a chore, feeling full too quickly, or not noticing those hunger cues. Now, more often than not, somebody's specific brand of ARFID falls into more than one of these buckets. Like ARFID usually isn't just like a neat diagnosis that falls into only one of these categories, because people are complex beings and it's a multifactorial condition. So when should a child be evaluated for ARFID, and how should parents go about it? Anytime feeding your child results in significant stress or significant interference in your family's life, you should seek additional support. In addition, anytime your child's picky eating, sensory sensitivities, or anxiety around food results in significant nutrition deficiencies or growth disturbances or even weight loss, you should seek help. And it should be a major red flag if any of these things are happening and your medical team just says, oh, they'll grow out of it, or doesn't help connect you to more support. You should be heard by your medical team, and it's okay to get a second opinion if you don't feel that way. But I do want to recognize that this is easier said than done in some situations. Getting access to specialized medical professionals who have experienced ARFID can be really tough. So where should you start if you suspect that your child might have ARFID, or you want to pursue an evaluation because you're concerned about their eating behaviors? Your first point of contact should be your pediatrician. Next up, a pediatric dietitian, because the first priority is going to be making sure that your child is getting in enough nutrition to grow and to be healthy and thrive. And that may include a nutrition shake or a supplement for the short term or the long term. After your doc, and maybe at the same time that you're pursuing working with a dietitian, look for feeding therapy. This will be a speech language pathologist, so an SLP, or an occupational therapist, so an OT, with specific feeding experience. Not all SLPs and OTs have that. They're not all feeding therapists. I always recommend asking about their experience and expertise. So do they have experience working with ARFID? Do they specialize in working with neurodivergent kids? Are they trauma informed? And do they practice any sort of forcing a child to eat, escape extinction, or anything that removes autonomy from your child in the feeding process? Because those would be a red flag for me. Sometimes an eating disorder therapist can also be helpful, especially when the root of ARFID, or at least part of that, lies in trauma. If you're totally lost, Google is a good place to start searching feeding therapists near me. You can also reach out to your local children's hospital. That or an outpatient gastroenterology clinic often have ties to dietitians and feeding therapy practices. So who can diagnose ARFID? The people who can diagnose ARFID are a physician or other advanced practice provider or a licensed clinical psychologist. Now, is ARFID the most up-to-date and accurate diagnostic label that we should be using for kids who have feeding struggles? Maybe not. Pediatric feeding disorders, or PFD, that label may be a more appropriate and up-to-date way to talk about significant feeding struggles. PFDs encompass these feeding challenges within the context of medical issues that your kid might have, or any oral, motor, feeding struggles or deficits. While ARFID is more described as just kind of a mental health condition. So PFD looks at the feeding struggles more holistically. And I think the argument for using PFD instead of ARFID relates to this diagnostic criteria that the eating struggles for someone with ARFID can't be outside the realm of what's common within a certain medical condition. So for example, for a child with eosinophilic esophagitis, before it's, well managed on either nutrition therapy or medication, it's common for these children to choke or feel like food is getting stuck in their throat, to have meltdowns coming to the table because it's so uncomfortable to eat, and to have food aversions. Does this mean that this child doesn't qualify for a diagnosis because what they're experiencing is common, even though it's having a significant negative impact on their quality of life and their day-to-day? I think that's where PFD is more appropriate than ARFID. So when we're looking at a child with ARFID and we apply the lens of the pediatric feeding disorder diagnosis, we may get a more holistic view of what that child is struggling with, including anything medically or functionally, within the mouth, the throat, swallowing, rather than only what's going on in their brain. The official diagnosis of pediatric feeding disorder is still relatively new, but Feeding Matters is a wonderful organization that does lots of education about this for families and medical providers. Okay, so that is it on ARFID today. Those were the 6 questions. Hopefully you found that helpful. If you have any questions on ARFID, drop them in the comments below. I'll link some resources on ARFID, including a book. I'll link the Feeding Matters website below. Don't forget to like and subscribe so the algorithm brings you back here, and stick around for my Feeding Kids with ADHD video course, because that is going on and it's totally free. Okay, that's it. Hopefully you'll come back for more videos. Bye.